Hello everyone, and welcome to this live Q&A hosted by the Cleft Lip and Palate Association on the subject of speech and language, open to everyone in the Clapper community. So my name's Anna. I was born with a cleft lip and palate, so 25 years ago now. And I've been volunteering with Clapper for coming up to 8 years. And today I'm joined with Jacqui.
Hi everyone, my name's Jacqui. I have a son who was born with a bilateral complete cleft lip and palate. He is now 6.5. I have been volunteering with CLAPA since April 22, so just coming up on 2 years now. Normally I assist with the antenatal support group, but tonight I'm doing something different, and looking forward to the Q&A on speech therapy with everyone.
Thank you very much, Jacqui. And we'd also like to welcome cleft specialist Helene Somerville and Lucy McAndrew, as well as John Gilmartin from Speech and Language UK, who will be answering your questions. Helene, Lucy and John, would you like to introduce yourselves?
Who would like to go first?
I'm happy to go first. I'm Lucy McAndrew. I'm Deputy Lead Speech and Language Therapist of the Spires Cleft Centre. I'm based in Oxford, and I've been working here since 2004, so that's an awfully long time, 20 years, and I've been working in the field of cleft palate for 24 years, previously working in Cambridge at Adam Brooks Hospital.
And I'm Ellen Somerville, and I work for Hertfordshire Community NHS Trust as their cleft specialist speech and language therapist. And I cover mainly two cleft centres, CleftNet East, which is Adam Brooks Hospital, and the North Thames Cleft Service, which is Great Ormond Street and Broomfield. But we also have a few children at the Spire, so I sometimes do actually work with Lucy, and also the South Thames. And I've worked in clefts for slightly longer than Lucy has. I was working out over 30 years now. 1992 I started when I was working in New Zealand at the Cleft Centre at Christchurch Hospital, where we covered the whole of the South Island. And where I work now, I'm based in Hertfordshire, so I cover the whole of Hertfordshire and support all the children with cleft lip and palate.
Hi everyone, I'm John Gilmartin. I'm a speech and language therapist, and I work for the UK charity Speech and Language UK. I've been with them for over 16 years, and we run a range of services to really, part of our mission is to give children and young people the skills they need so they aren't left behind waiting to be understood. And we do this by creating tools for schools and nurseries, giving advice and guidance to families, and not forgetting putting pressure on politicians as well. So I'm really here just to talk about our universal offer to everyone, and I'll dip in and out between Lucy and Helen as and when. Nice to be here.
Well, thank you very much for joining us today, and thank you as well to everyone who submitted a question in advance. If you do have any questions whilst watching, please do pop it in the comments, and someone from Clapper will either respond directly or pass it on to us. We have had quite a lot of interest on this topic, so we will do our very best to answer everyone's questions. However, if there are any we don't get around to answering, then we will try and get back to you in the chat feature after the event. Right, so we better get on with the questions. For the first part of this event, we'll be focusing on questions regarding speech in adults, and then we'll move on to questions revolving around babies, young children, and older children. So the first question says, I am 50 years old and was born with a cleft palate. I've always had problems being understood by others, but I'm worried it's too late for me to change how I speak. Can anything be done?
So I'm going to answer, I'm probably going to kick off with most of the questions today, and Helen's going to chip in and add her perspective from the community perspective. So firstly, that's a really great question, and there are many considerations here. So clearly at age 50, that there's an element of habit here. So you'll be used to speaking in the way that you've been speaking for your entire life. So it really depends whether anything can be done on the nature of the speech difficulty. So it may be related to one of two areas. So If it's related to the quality of your speech, so whether you feel your speech sounds nasally sounding or whether you can feel air escaping out of your nose, if this is the case, then things can certainly be done. And this may be an option of surgery, or it may be an option of having a prosthesis device made by a dentist to wear in your mouth. So if it's an option for surgery, then obviously you would get in touch with your local cleft centre and request to see your speech therapist there, who will assess you and see if you're, if it's appropriate for you to go forward for investigations to consider surgery. If your concern isn't about the tone of your voice, but it's more about the way you make particular sounds, so it may be that you're worried about how you make an S sound, your speech therapist may be able to help you change the way you make that sound. It may be that we can help you to change the way you make that sound, but it's another thing actually putting that into your everyday speech at age 50. So again, you're trying to change the habit of a lifetime. So it really depends on the whether we can help you to make that sound, and it may be that the difficulty is related to your teeth and your jaw and the way your teeth and jaws come together. It may be that we can't help you change the way you make the sound that you're worried about, but if we can, and you're really motivated to change your speech, then possibly therapy could really help you. But it may require a considerable amount of therapy at that age, but it's definitely something that we would be happy to look at and see if we could help you with that. Ellen, I don't know if you
know the same. Just to chip in one sense, if it is that it's a speech, there's a particular sound or a couple of sounds that maybe need changing. I know a few years ago we had the motivational interviewing perspective at the SEN day, and it was very much sort of thinking about, you ask the question, what would my life be like? So it's almost like, what would my life be like if my speech was clearer? And then what steps do I have to put into place for that to happen, for that behaviour change? So with the children, I only work with children. It's very much, it's the adults around them, it's the parents and the school staff who know that they have to do that daily practice with the child in order to affect change. But with an adult, you're the person that's got to do that. You've got to think, do I want to change the way that I sound? Can I, you'd need to spend time with the speech therapist to see if you're what you call stimulable for the new sound. And then you've got to learn to use it. And it's very much a sort of a graded step. So yes, it's sort of like, yes, it's possible, but it's a lot of work. Yeah.
Agreed. I think it's a lot more work as an adult, just because you've got into such a habit for so many years. It's really difficult to change that habit. But I have worked with adults and managed to change the way they articulate particular sounds. But we'd be really happy to see you to.
And one quite fun thing that I sort of do with any of the adults that when I'm seeing a child now, just to get them to sort of think about the fact that it's not just a matter of being able to make the sound. I'll give them a sentence. So, for example, get them to say, I saw Sam sitting on a bus. And then I say, okay, each time, instead of the S, I want you to replace it with G. And you can see them there going, I saw Sam getting on a bus. Oh, no, hang on. Bug. Yeah, okay. And then I say, how easy was that? Because you so often get the parents sort of saying, oh, you think the child's lazy. And it's like, no, the child isn't lazy. It's actually a lot of cognitive load to replace the sound that you're already making with a new sound. And sometimes even just doing that yourself with two sounds that you can easily say, almost just thinking, can I do this? Can I actually, because that's the sort of thing that in one sense, if you're correcting an error, that's sort of what you're having to do.
Yeah. So the answer is yes. Things can be done. Yeah.
So what's the next question?
Thank you, Lucy and Helen. So the next question is, are there any surgeries you can have as an adult to improve speech clarity? So you touched on that briefly there, Lucy. So I don't know whether that means maybe specific surgeries or what surgeries are available.
Yeah, so yes, definitely you can have surgeries to improve speech as an adult, and there's no upper age limit. I did actually ask our surgeons in preparation for this question, you know, what's the oldest adult you've operated on? And one of our surgeons said, you know, 78. It's all about the health of the individual, and you know, if they're in good health, then you know, you can have anaesthetics up to you know, a ripe old age. So if you're not happy with the tone of your voice, or you feel air's escaping down the back of your mouth, down your nose, or through a hole in at the front of your mouth, if you're not under your cleft team currently, as you're an adult, you can get in touch with your local cleft team. You may need a referral via your GP. But many cleft centres have adult clinics where we see returning adults to cleft teams. It may be that they've had their surgery done in another country, or you know, and have just kind of come to the point where they think, I'm just not happy with my speech, you know, can anything be done? So in the first instance, you would probably have an assessment with a cleft specialist speech therapist at the centre. They would assess your speech and your suitability for an operation. And if they feel that surgery would be helpful, they would refer you to a special clinic, which we refer to as palate investigations clinic, or it might be named slightly differently at different cleft centres. But basically, we would usually do some investigations to look at how well the palate's working for speech. So that may involve a really detailed speech assessment. We may want to record that. We may do an X-ray of your speech, so just taking a lateral kind of profile view of your palate, so we can see how well your palate's kind of lifting, and is it reaching the back of your throat. Sometimes we do an endoscopy, where we put a tiny little bit of anaesthetic spray into the nose and put a tiny little camera to the back of the nose to look at how well the palate's closing. And then we look at all of those findings from the speech assessment, from the X-rays, from the endoscopies, and we also take on the patient's or the adult's perspective on how concerned they are about their speech, what kind of impact is it having on their daily life and their well-being, and we look at all of that, and we consider, you know, is an operation going to be something that's going to be really helpful. The surgeons need to find something to fix, so we need to find, you know, we need to find something on the X-ray or the endoscopy. So we need to see a gap in the palate closure at the back of the throat. And what we see will then help the surgeons and the speech therapists decide which operation is the most suitable operation.
And the ones that I've been involved with, where, I mean, because I've still been involved with some of the palate investigations, and obviously prior to when I was still working with adults, it depends what you see on that X-ray, because sometimes you can see that it's a beautifully mobile palate, it's just too short, or it can be that the palate isn't lifting. You know, there's different things it can be, can't there? And now there's a range of options that the surgeons, you know, there's like a different sort of tools up their sleeves as to which surgery. And also surgical techniques have changed, like the buccal flaps. I mean, if people are coming back at sort of 40, 50, 60 years old, there's no way that surgery would have been available when they were younger. So it may well have been when they were younger that actually that was the best that could be done then. But actually now there might be a surgery that will work for them, you know, but it's quite a big workup, isn't it? It's not you get referred in and within 2 months you're going to be on a surgical list. I mean, you know, there'll be a waiting list for each of the procedures, but certainly because I go to the joint clinics, I still see the adult patients when they've come in sort of pre and post. And, you know, I've seen certainly some people in their 50s and 60s who've had very successful surgery.
Yeah, that's a really good point. There's a waiting list to go to the investigations clinic, and then there'll be a further waiting list to have the surgery. And if your speech is pretty clear, then the surgeons have to prioritize which surgeries they do. So it may be that as an adult, if your speech is relatively clear, so you can be understood, they might need to prioritize younger children who are very unintelligible. And Ellen's absolutely right. There are different types of surgery which broadly fall into two categories. So one is the surgery that's on the palate. So it puts the muscles into a better position in the palate and makes the palate longer. And then the other type is surgery to the back of the throat. So maybe putting a little speed bump on the back of the throat to kind of close the gap a bit and obstruct the gap so that the palate closes well. And then we should probably say, sometimes surgery is not indicated. It might be because of health reasons or other medical issues. And if surgery is not an option, then there's always the option to consider a prosthetic device. So again, many teams will have a dentist who can help make an individual kind of plate that you wear in the mouth that has either a lift to kind of lift the palate, or a bulb, so a little blob, really, acrylic blob at the back of the throat. And again, that bulb or lift just helps to make that closure better, so that you sound less nasally sounding. So yes, definitely there are options to have surgery as an adult.
Okay. Yeah, thank you. And then the next question says, can I ask you to outline what an SLT journey may look like from birth onwards? That's quite a long period of time.
Yeah.
So, with this one, there is the general outline, isn't there, where this will, depending on which sort of centre that you're from, but it starts with some kind of babble advice. Is that, all the centres do the babble advice? I think they do, don't they?
I think definitely most centres are moving towards seeing families younger, and what we call early intervention. Yeah, so different centres have different kind of protocols.
So some of them I know will have that as a pre-op babble group, maybe. Some of them have a post-op, they might have both. And then the definite times where there's an assessment or a definite session with a speech therapist from one of the centres is at 18 months, at 3 years and 5 years. And then are they routinely doing them at 10 and 15? Yeah, so that's for 10 and 15. So those are the times where you will always come in and see a speech therapist. And then they determine whether there's actual therapy needs as well, which is when sort of people like myself tend to get more involved, where we will then be the ones doing the sort of the in-between bits. And it's the key points at the cleft centres that the child is sort of seen. So they were sort of standardised, 20 odd years ago, as being the definite times that all the children would be seen.
Yeah, so it may not be one therapist that your child sees. It may be a combination of the therapist at the centre and then a local therapist, or even a cleft kind of trained therapist such as Ellen. And some therapists can deliver therapy into the education settings, so going into nursery or schools. So it does really it is kind of locally kind of specific, isn't it, depending on which team you're under and what your local provision is for speech therapy. So every child's journey will be slightly different, but as Ellen said, there are the kind of routine assessment points. So we will always offer you kind of regular monitoring right up until adulthood. I think most centres also offer a kind of 20-year kind of final year, or between 18 and 20 a final year review, just to kind of say cheerio.
That's great, thank you. We're just going to take a very short break in the questions to hear from Anna, who's going to share her personal journey with us.
Yeah, so tell you a little bit about my story. So I was born with a cleft lip and palate, and everyone used to say to me, "Oh, that's a big one," especially one of my surgeons. So I don't know what that means medically, but that was an ongoing comment. And I had my last operation when I was 19, so I'm 25 now, so about 6 years ago. And luckily, I haven't had too many issues with speech comparative to other people with cleft lip and palate. However, I definitely have had a journey with my speech. So issues first started when I was about 4, when I started in primary school. And it was then that my mum first noticed that I had problems. But first she noticed problems with my hearing, and then shortly afterwards I was put into speech therapy. And the other night I was speaking with her, trying to figure out the timeline, and we're not 100% sure that the two are linked, but she did seem to suggest that there was some sort of connection. But it might have been, having heard what you've just said, maybe I had one of those reviews and they picked up multiple things, and so they all happened at the same time. Yes, so then at age 4, they discovered I had 60% hearing loss. And then up until that point, it kind of gone unnoticed because I taught myself how to lip read. And then I had some grommets put in. And then after I recovered from that surgery, I started with speech therapy. And yeah, I've always had a slight lisp, and I particularly have problems with S and also the sound, the th sound. And if you listen carefully, it's still not quite perfect, but it doesn't matter. But yeah, so I started sessions at East Grinstead Hospital. And as it was going to be regular treatment, my mum decided to go there instead, because all my other, well, everything else had been done at Gosh, but it was regular every week. So it was much easier to go, as it's much closer to home. Yeah, and so one of a large part of my speech therapy was that included exercises that the speech therapist gave to my mum to do at home. It was a while ago, so it was all these sheets of paper. And to say I was not a fan is an absolute understatement. While my younger brother absolutely loved talking about Sam, the superhero, I really didn't. And my mum, she really tried as much as she could, but not always with much success. I think my brother had a lot more excitement around those couple of months. But yeah, so after 8 months, they discharged me, and I didn't really have any problems with my speech for a few years until at age 7, I had lip revision. And this did affect my speech for a short amount of time. But my mum had saved that one bit of paper since I was 4 that the speech therapist had given her, and practicing at home regularly, my speech returned to normal fairly quickly. And then the next problem I had was probably age 12. I had, I don't think this is the technical term, but teeth caps to make my front teeth bigger. And at this age, I was really quite aware of my mouth and my teeth, and also how I spoke. And whilst I had had braces from age 9, the problems with speech I had were no different really to any of my other peers who also had braces. So it wasn't really an issue until the teeth caps. And then I struggled quite a bit, but I think maybe more mentally than physically, because within a few weeks I got used to it, got used to how my mouth felt, and my speech came back to normal. And then last but not least, I had jaw surgery at 19, called a double osteotomy. And I was told that there was quite a high risk that when my jaw moved, my speech would change, because my palate might move and not connect properly. And I was quite aware of that. They talk to you about that a lot, the surgeons, when discussing the surgery. And luckily that didn't change. Luckily my speech wasn't significantly changed like medically, but I felt that it had changed. So obviously when they move your jaws, my mouth felt completely different, and my lisp came back, and I found it quite hard to form words as well, especially the way my teeth joined to pronounce T's, and like those harder sounds was a bit more difficult. But once the swelling went down, which did take about a month, once the swelling went down, it became a little bit easier, and I got used to how it felt. It all kind of slotted back into place. But yeah, over the years, my mouth changed a lot, and my teeth moved, and correcting my speech kind of became something that I think I got quite used to, and you learn to correct yourself. And now kind of my lisp does come back occasionally, especially if I'm a bit nervous. But generally I'm really quite confident with my speech, and that's been due to a lot of help with the speech therapist and the cleft team. They've been really great. So yeah.
Great, thank you, Anna. That was really interesting. I'm sure really helpful for a lot of other parents to hear as well. So back to the questions then. The next one is, how likely is it for a child born with cleft lip and palate to not need speech therapy?
How long's a piece of string? Helen, would you want? So I think it's important to say that if you have a cleft lip, only and not a cleft palate, then you have no increased incidence of speech difficulties outside of the normal population. So only if you've got a cleft palate, may you have difficulties with speech.
So to start with, as we sort of said before, actually all the children will still see a speech therapist, because you'll have this universal, whether it's called the babble workshops or input modelling workshops or sound play, whatever it's sort of called, that's universally offered to all the children. And then it'll be, either at, within that sort of group, or the individual appointments that you then get as to, what's required. So, and again, this is where people like me get involved, as well as the ones at specialist sort of centres, is that we're sort of listening for the child, as they start to babble and talk and say their first words. We're very much interested in what they're saying. So if they're just sort of saying, mum, mum, ma, but instead of dad, 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 they're saying na, 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 we're listening for sort of like, oh, that's what they're going to be doing if their palate can't quite sort of, reach. So you're sort of listening for, can their palate close off to make the sounds that they need to, in English or whatever language it is that they're going to be speaking. And then the other thing that we're also sort of, listening for is actually how are they saying the sounds, because sometimes it may be that actually they're just using the back of their mouth rather than the front. And so it depends what we're listening and hearing as to whether we're thinking, well, actually they might need to see the surgeon again, or whether they're going to need a particular type of therapy from us. And, so it's completely individual for sort of every child. And again, where one of the things that, got brought up before, is that definitely, yes, hearing can have an impact, because again, actually, if you can't hear well, then your early babble often sounds very similar to a child whose palate can't close. So I've certainly had, children that I've seen that have been referred in at 2, and all they're using as nasals and vowels, so sort of mama, nana, and the vowel sounds. And with what we call diagnostic therapy, which was sort of, basically sort of targeted input modelling through play and that kind of thing, one child just completely took off and got all their sounds, and the other child, it was clear they were planning to get the sound and they were using their tongue and lips in the right place, but they were all nasal, because actually, having been referred on to palate investigations, it's obvious that that child's palate couldn't close. So, it's so it very much sort of starts off that 100% of the children will be seen, and it slowly narrows down to those that actually need ongoing therapy, but all of them will also always have their monitoring and advice sessions. And I don't know, what's the percentage of children that actually have speech therapy? It is still quite high, isn't it? Is it 50%, 60%? I can't remember what the figures
that
are.
Have speech therapy or have speech surgery?
Oh yes, of course they're different. Yes, yes, I know I'd seen the figures for speech surgery, but yeah,
it's about and well, in my experience, I mean, reports vary a lot in the literature and out there, but in my experience, about 20% of children will have a further operation to help with speech after their primary palate surgery. And the Crane database, so that's the national database that holds information on the majority of babies born with cleft palate across the whole of the UK. I had a look earlier. They reported in the latest report that by 5 years of age, 68% of children achieve speech without significant evidence of articulation errors or speech difficulties that require input. So the other, I mean, that may sound like quite a lot that still have difficulties, but they may be just mild articulation differences that don't actually need therapy, or they may be articulation difficulties that may need a further operation. So yeah, it's every child is different and unique.
Okay, well, thank you. The next question says here, will clarity be a persistent challenge for those who are cleft affected, or can the majority of challenges with speech be addressed with early intervention from the SLT team? That kind of covers, you've already covered that a little bit, but what do you think?
Again, I think it's important to just clarify that if you have a child with a cleft lip only, then clarity shouldn't be a persistent challenge. So they shouldn't present with any more speech difficulties than in the normal population. I think it's a kind of national aim for speech therapists working with children with cleft palate to kind of achieve normal, and I don't like saying the word normal, but typical speech by school entry. And we achieve that through our early intervention protocol, whatever package we offer in our local centre, and we try to prevent bad habits. So we give advice and we talk to parents about things to encourage and things not to do, and we hope to steer speech into the right direction. And
some of it again is things like it'll depend on the hearing history. Some children have huge challenges, multiple ear infections, where they'll have fluctuating hearing loss, which we know will have a huge impact on their speech development. Again, I've got several children where they're awaiting secondary surgery, and every time their surgery dates come up, they've been ill. So they've got into all sorts of compensatory articulations because their brain is so clever. They're trying to make a distinction between sounds. So they're making them in their throat or making sounds through their nose. And again, through nobody's fault that that's happened. So those children are going to require a lot more speech therapy, because once they finally had their surgery, you're then going to be unpicking the patterns they've got into. But certainly the aim is always to do as much as we can from an early intervention point of view. But again, it depends. You may have been given the best advice from the cleft centre, but there's no local speech therapist to help you carry that out. And again, there's only sort of so much that you can remember as a parent without sort of support. So again, we aim for a gold standard, but maybe sometimes we're only able to deliver bronze, perhaps. I sort of think of it, gold, silver, bronze. Yeah.
That's great, thank you. The next pre-submitted question we have is, am I failing as a parent if my child needs continued SLP? I might just answer this as from a parent's perspective quickly, if you don't mind. No, definitely not. These are factors that are outside of your control. As Helene just mentioned, things like blue ear, hearing loss, all these sorts of things can affect it. Certainly it's a very natural feeling to have, and I think that feeling of failure and guilt for a lot of us parents goes right back to the diagnosis stage. So it's certainly a very natural feeling to have, but one thing I've sort of learned on our journey is not to compare your child's journey with another, and that's cleft or no cleft. If you have a non-cleft affected child, don't compare the journey with someone else. I can remember thinking with my son Leo that after his surgeries, his palate repair, etc., that he would be able to do certain things within a short period of time. That didn't happen. For example, things like blowing out the candles on his birthday cake, sucking through a straw. Those things didn't happen for us until he was 4.5. So don't compare your journey to others, and it's just you will get there. Your child will get there in their own time. It's certainly not a feeling of the parent. If your child does require speech, and as it's already mentioned, most of these children will be on that pathway.
Beautifully
I don't
answered.
know go ahead.
I don't think I can add to that. I think you've said it all, really. There are so many different factors, aren't there, that can impact and influence a child's progress in therapy that are out of your control. And as a parent, there's an obligation to bring them to appointments and to maybe carry out advice and therapy. And often that's difficult. I often get mums come to me and say, they'll do it with you, Lucy, but they won't do it with me when I go home. And that's life, isn't it? And kids have other siblings and parents work, and life goes on. But we do.
And that's where, again, you know, sort of certainly some of it is I remember sort of talking with a therapist from America, and they were sort of saying, you know, if the child doesn't want to do the activities, you're not making them interesting enough. It's never that the child won't engage, it's that the adult isn't making it fun enough. And it's like, okay, I get that, but equally, you know, I've had children, I mean, they're older now, but it's that whole, it's still hard to sort of, you know, think, how do I find the time to sort of do all of this? And very much I'm always sort of trying to sort of think of things, even like particularly if it's a sound or a word, just thinking of things like every time when you're going up the stairs and down the stairs again, you just practice your sound as you're doing it, or pushing them on the swing in the park, or things like that. Like really trying to make it that it's active things that you're doing. It's not more schoolwork, like coming in and having to sit down and do tabletop activities and all of that kind of stuff. So very much it's, you know, we're in partnership with you as the parents to sort of say, okay, what's your child's interests? And we're the ones that are going to try and help you find ways of incorporating, you know, the therapy into your day, because there's no magic wand. The children aren't going to suddenly get their sounds without there being some work, you know, but it's how do we go about doing that? But certainly it's not about, yeah, beating up the parent if the child isn't making progress, because sometimes we're doing the wrong therapy as well, you know. So yeah, it's a partnership.
And to add to that, I remember being 4 or 5 going, I know she wants me to say that and I'm just not going to do it. And I didn't want to, you know, there's also this.
We've got children like you.
I think a lot of parents think that speech therapy is making the sounds, and it's, you know, and obviously that's the end goal, and that we want to improve production, but therapy is also about listening and just giving children the opportunity to hear the sound in isolation, in words, repetitively. So you can be doing your therapy. It doesn't have to be that you have to set aside time. You can be doing it, you know, as you're doing the shopping or walking up the stairs, as Elaine was saying, just, you know, inputting and making the sounds so that they can hear them and they can see them. Yeah.
And just a little point to add to that, Lucy. I'm absolutely loving what you're saying here, everyone. And just from my modest perspective as well, we like to think about goals as not being work on speech sounds as well. And actually the goal and the target is for good communication skills, and working on our speech sounds to get there can be a sometimes fun journey as well. So yeah, sometimes how we talk about the goal and the target can help to motivate as well.
Yeah.
I think that was a really good little discussion. That so the next question, these are quite similar, so I'm going to ask them together. So the first one says, there's such a delay in my 10-month-old being seen by a speech and language team. What can I do to help in the meantime? And secondly, as a grandparent, I'd like to help ensure a consistent speech progression. Is there anything that I should be following? My grandson, who's 10 months old, likes doing speech work with me. He seems to associate it with playing with grandma, so I'd like to make the best use of his interest in this.
Oh.
It's lovely to hear that grandma is keen to support speech progression, and that grandma recognises that infants as young as 1 year of age can, you know, interact, and actually kids as young as 1 and younger than 1 are like sponges, and they will just watch really intently. So there are lots and lots and lots of things we can do at that really early age, and it goes back to what I was just saying to the last question, that it's not just about the infant making the sounds, it's about them watching it. So, you know, we do this approach called input modeling, which is multisensory. So it's not just about hearing the sound, it's about seeing the sound and feeling the sound. So making sure that you are really close to your infant, and getting right down to their level so that you're face to face. So rather than reading a book next to your child or your infant, having them facing you so that they can see your mouth when you're making the sounds and words, and letting them feel the sounds. So making the sounds on their cheek, on their hands, blowing. And it doesn't need to be speech sounds, it can be non-speech sounds, so blowing raspberries, even blowing activities where you're blowing onto their cheek, or blowing a tissue, or we're just trying to show them air coming through the mouth, because many speech sounds are made on air coming out of the mouth. So there are lots and lots and lots of things we can do at that young age, and with our knowledge of knowing what children with cleft palate find difficult. So as Ellen said earlier, they often prefer sounds at the back of the mouth. So it's really lovely to show them at that young age sounds at the front of the mouth. So sounds like a p, 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 and they're all very visual sounds. You can see the tongue coming through and the teeth, and maybe even doing a t and a d with your tongue slightly forward. So th, 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 and da, da, daddy and teddy. We're just showing infants that the tongue comes forward for these sounds, because if you just say daddy or teddy, you can't see the tongue's hidden away. So we do recommend bringing your tongue forward, even though you feel a bit silly making those sounds. So getting really close to your infant, making those sounds softly at the front of your mouth, stretching sounds. So some sounds you can stretch, like and you can make them a bit longer. You can do them really close so they can feel the air coming out of your mouth. Ellen, did you want to add any into?
I was going to say, so there's again, when they're really little, so baby, when they're sort of under one, they just love watching your face, so you just making the sound is entertaining enough. And then as they get a bit older, often you can sort of do it with different activities. And I haven't got any of my props with me here, but even something like sort of threading a cotton reel or threading a bead, and as you're sort of doing it, as I'm threading it, I might be going ba 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 if it's a short sound, or threading it and going shh if it's a long sound. And actually, quite a few of the cleft centres have made some beautiful videos. Some of them are really short, kind of an explanation about what input modelling and babble play is, and longer ones up to half an hour. And Lucy has a starring role in one of them from the Spires, and there's also the South Wales team have got another one that's half an hour, with just loads of different activities, holding the toys up and showing you this is what you can sort of do with this toy. And again, even just fun things where, again, we're talking about feeling the sound, something like a p, 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 you can feel it on your hand, and doing fun things, whether it's with bits of tissue or paper. I think if you're sort of like doing this, I always sort of show the children with something like a bit of paper on the back of my hand and just going and it falls off, that kind of thing. They'll watch it forever. You don't have to make you don't have to come up with loads of props. You can just make really, really sort of fun different things like that.
Bubbles are great.
Bubbles are great. And again, there's different making sounds with different books as well. I'm always sort of doing this where if you're doing the bear hunt or any of those sorts of things, you can make the sounds as part of the story. You don't have to just read the words. And yeah.
That's great. Thank you. There were some really good ideas and resources there in the answer to that last question. We've actually just had a question come through from someone watching the live, which is a bit more specific. So the question is, hi, my 3-year-old has real issues speaking due to a lot of her sounds coming through the nose. Is there anything we can do? We have speech therapy booked in, but I was wondering if we could be doing more. Thank you.
Yeah, so is that air coming down the nose for speech sounds? Yeah.
Yes, air coming through the nose, and down. Yeah.
So this is what we were talking about earlier, that the children, they're clever. They find if they can't do an S through the mouth, they just find other ways of doing it. And one of the really kind of common ways that children with cleft do an S is they might make the sound down their nose. So they'll do I saw Sam for I saw Sam, and they'll be doing it because they've mislearned it, and it's not because of a structural difficulty that needs surgery, but it's a mislearning that they've just kind of learnt the wrong way. So therapy is really helpful for that. And things that you can be doing is what we were just describing, the kind of blowing activities. So as simple as just kind of blowing the tissue or blowing cotton wool across a table, or the windmills, you know, I've got one here, that kind of thing, where they can see. So what you're trying to do is show them lots of airflow coming out of the mouth and do lots of talking about it. So describing it. Can you feel the air? Can you feel that tickle on your hand? Can you feel the air coming out of your mouth? And contrast that with air coming out of the nose. So lots of airflow activities are really good for that. In the time.
Again, I mean, it depends, because it could be that it's passive air escape. So again, there's the videos on the Bristol team have got the ones with nose holding, because sometimes it can be that if the child, maybe they're trying to say baby, but actually it's coming out as Mamie or something like that. And actually, if they're saying Mamie, baby, 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 when you do the nose holding, it then becomes baby from, you know, Mamie. So sometimes, again, the speech therapist might be trying different things like that, because sometimes nose holding can make the sound clearer, and that would indicate that maybe there's air coming out of the nose sometimes. Or but the sound that Lucy made earlier, if you do that sound, but then if you're actively sending that air, when you do the nose holding, you block it. So if you're saying he and you go, it blocks it. So nose holding could be a technique that we use in therapy to try and work out what the child is doing. And then, yeah, sometimes you can sort of get away with the child making a sound through their mouth, like doing a instead of a to start with, to see whether they can do that one without it coming out of their nose. So it's a sort of thing where really it's that first therapy session where you're trying different things out to see what the child, you know, might be doing, you know, and then work out how you're going to change it.
Yeah.
Describe diagnostic therapy, isn't it? Working out, is it a learnt pattern that we can correct with therapy, or is this actually something that's passively happening because the palate's just not closing?
The nose holding actually was a technique that really helped with Leo. I remember being in the speech therapy session and her describing what she was, and I was like, oh, he's never going to comply with, you know, someone holding his nose, and he didn't, but he was happy to hold it himself. And then we just kind of so if he would say something and I could hear the sound coming through his nose, I would say, oh, Leo, I heard that through your nose. Can you try saying it through your mouth? And he started off, then he would hold his nose, he would say it with the nose held, which would correct it. And then over time, so we did that initially, and then over time, he was able to take the hand away and change the sound. You know, he kind of understood then through the nose holding where it was kind of going wrong, and he was able to correct it himself, which was great. So thank you. So the next question we have is, what should I expect in terms of speech and language therapy after submucous cleft palate surgery?
So if we just refresh, so in submucous cleft palate, what's happening is the muscles inside the palate are separated. So instead of being together, they're separated, but the skin, so the mucosa, grows over. So in submucous cleft palate, we don't often realize it's a submucous cleft palate until the child starts to talk and all the sounds come out as nasal sounds. So the surgery aims to put the muscles back in the right position, basically same as in a cleft palate repair, as in the baby palate repair. So the situation is really the same as in a cleft palate. It really depends on the speech presentation before the surgery. So if there's a nasal tone, but the child is making the sound with the correct articulation, so they're getting the correct placement for all the sounds, it may be just that all they need is the operation, and actually everything will fall into place after the operation. But if your child has learnt kind of bad habits, or those things that we were talking about, pushing sounds down and out of the nose, or making them in the throat, so a kind of a throaty noise. So some of our children will say batney, atney for daddy, rather than a d in the mouth, they'll do it in their throat. And then maybe they have the surgery to put the muscles in the right place, but they're still are doing that sound in their throat. So they may need therapy to help them change their articulation, the place of articulation. So it's different for every child, and it depends what their speech is like before the operation. Anything to add to that, Helen?
No, I don't think so.
Yeah.
Hey, lovely, thank you. We've actually got a few just comments to briefly say. So the first one says, I don't have a question, but I just want to say our little boy Reggie, 3 years old, loves his speech therapy sessions with Lucy. It's the highlight of his month. He often asks, when can we go and see Lucy, Mummy? Reggie has come a long way, thank you to Lucy.
Oh, thank you.
The second one says, hi Lucy, our son is now 20 and he was a patient of yours before he went to school and benefited hugely from your help, so thank you.
Oh, that's so lovely to hear. Thank you very much. Yeah.
So yeah, we're just going to take a very short break now from the questions and hear from Jacqui, who will share her own personal story with you. So
yeah, so I have a terrible memory, so I actually had to go hooking out. I tend to keep a lot of Leo's appointment letters and things to give me an idea of like dates and stuff like that. He's had quite a lot of intervention from a lot of different clinics, but I feel like speech therapy has been like the main one that has been the most kind of consistent and frequent sort of throughout our journey. And as Lucy mentioned before, kind of different regions work different ways. So most of our intervention has been with a community speech therapist. Obviously, we're seeing at those specific timelines by the cleft team. But the first letter that I sort of found was actually from when Leo was 6 months old. So he was actually seen initially for feeding by a speech therapist. I'm going to assume that was because he had very severe reflux, and we had quite a lot of feeding issues in the early days. So we would have went to appointments and went over things like diet, texture and fluid thickness. He would have been on Carabel and his milk and stuff to thicken that up. She would have advised on positioning of the baby when feeding and stuff, and different sort of compensatory strategies in terms of like lateral tongue exercises, foods to avoid, ensuring that any sort of residue was cleared, just different techniques that kind of worked for us, like giving him his tummy, to help clear food and things. So yeah, I feel like we've sort of always been under the care of speech therapy. And then obviously as he got older and began to talk and stuff like that, it was then on to the sounds and the words. I'm trying to think. I don't know what we tend to go in like 6-week blocks with the community speech therapist and then sort of get reviewed. And over time, as I say, 6.5 now, he actually got discharged in January from community speech. So that was a big milestone. He'll still be seen, obviously, by the cleft team. The words that he mainly struggled with were his F, like F sounds, and the his S sound was quite lateralized, so the air came down the side of his tongue rather than the center of his tongue, and had more of like a slushy sound quality to it. And over time that just gradually improved. Obviously things like hearing had an impact, so he's had 2 sets of grommets so far and is just waiting on a review again from ENT because his hearing, I've noticed this past few weeks, is just taking another dip. So he'll probably go into hearing aids this time, having had 2 sets of vents already. And that certainly can obviously have that knock-on effect, especially when they are younger and they're learning and stuff. He loved his speech therapy. He loved going to speech therapy. I think it was almost like, as much as it was a milestone being discharged, it was almost a bit sad as well, because it was something we were so used to going to. It was kind of part of our life almost, and it made that close bond and connection with the speech therapist. So it's a bit bittersweet almost, being discharged. I'm trying to think if there's anything else. He obviously had yes, that inconsistent nasal turbulence. So you could tell with him that when we were reviewed by the cleft team, they would have done you like the little mirror under each nostril. And he actually had the video fluoroscopy, I think I've pronounced that right, last summer, which kind of did show, basically he was quite borderline. So he's had enough speech therapy to really improve what that can do, but there's still a question over the structure of the palate and whether or not he'll need a lengthening surgery. Because he's so borderline, we were told basically to go away. I was asked to go away, speak to his teacher, speak to, you know, friends and family, and, you know, think about how much is it actually impacting on his life. So that actually reassured me quite a lot, because you feel like you're in control a little bit more again. You know, a lot of times throughout this journey, you sort of feel like you're not in control of what's going on, and it can be quite nerve-wracking and everything. So it was quite nice to kind of have almost not an option as such, but, you know, because the teams and the surgeons and the professionals are always going to do what's right by your child. But yeah, it was, you know, a relief to hear that possibly that's a surgery that he may not need, but obviously if he does need it, I would want him to have it, you know. So yeah, that's kind of the stage we're at now. We've been discharged by community speech, and we're just kind of waiting on that review to see whether he will need another surgery, but at the minute hopefully not. And so far so good. And obviously we know if there's ever any further issues down the line, we can always just get back in touch.
Yeah, take your time, Jacqui, in that decision, because there's no hurry. You know, you really don't, and you can wait until, you know, your child, you know, has a view themselves. It's all about the impact. So, and there's no harm in waiting, particularly if you're not sure. So take your time.
It's really helpful. Thank you.
Yeah, thank you, Jacqui, for sharing. I think that waiting period, it feels really nerve-wracking, but we had that too, and we waited quite a long time in the end. I think it was nearly close to a year before we made a decision, and that kind of helped. You feel more reassured because you kind of have had time to think about it rather than rushing into a decision. Anyway, okay, so the next question, number 9 says, my 7-year-old grandson is still having lots of problems with his speech. He babbles, and most of the time you can't understand him. He hasn't seen anyone for over a year now. He has also had a checkup at the local dentist. One of his top teeth, which are turned up onto his palate, had snapped. He has been told he needs to go to the hospital to have it taken out, but told his teeth are rotting now.
I understand your concern, and by 7 years of age, we hope that most children are intelligible, and, you know, being unintelligible can cause a lot of frustration and have an impact on well-being and friendships and so on. So I think we really need to understand why he's unintelligible, what the reason is, because it could be many factors that contribute to being unintelligible. So it's that diagnostic kind of working out what the cause of the unintelligible speech is. Is it about how well the palate's closing for speech? So is it a structural thing that may need an operation, or is it about articulation, so the way he's making the sounds? Is that something that can respond to therapy? Or it might be factors that are not related to that. He might talk really quickly or have some other speech difficulty that's not related to the cleft, like disfluency or mumbling, or there's lots
or even potentially another, because certainly I sort of think we can have a tendency as cleft therapists to just focus in on cleft speech and actually forget that a child is just as likely as any other child to have any of the other things that actually you're referring to speech therapy for. So it may well be that it is actually a different type of speech sound disorder, and it's not, you know, it could be an inconsistency disorder or consistent phonological disorder or that kind of thing. So you really need, you know, certainly needs to be seen again by, you know, a speech therapist. You know, it may be, I mean, it's always difficult when it's not your, you know, not your case, but making sure that the full speech assessment has been done, so that, you know, you haven't only gone down one route, because it may well be that actually phonological therapy is what's required, not articulation therapy or that kind of thing. But equally as well, I think most cleft teams have their own dentist as well, don't they? So a local dentist, you'd want somebody from the cleft team to be making that decision, because it may well be that actually that whatever they're going to do, it would be done at the cleft centre, not at a local hospital. Is that your understanding with the dentition side of things, Lucy?
Yeah, I think different. I mean, having dentistry is a little bit tricky nationally at the moment. So finding a local dentist, it's really important that you have a local dentist and that you attend, your regular dental checkups, because we know that children with cleft palate do have difficulties with dentition. So the enamel quality is not always so good, and it can be difficult to access because you can get teeth in the wrong position and twisted, and can be difficult to brush and access. So we know that children with cleft palate do have more dental decay, and it's really important that that's kind of dealt with, and they're looked after, kind of the baby teeth, so that if you do need any further surgery, all the surgeons are really absolutely, you have to have no dental decay before they will go ahead with surgery, because it's a source of possible infection that can impact kind of wound healing in surgery. So it's really important to have as clean teeth, so brushing teeth and keeping them as clean, and regular visits to a dentist, and they will recommend which teeth need taking out, or which you can just leave, and most cleft teams do have a pediatric dentist or a restorative dentist, but some cleft teams don't. So there is a kind of, nationally, it is different depending on where you are, but really important to try and see a local dentist. And if you're struggling to see a local dentist, and you do have a dentist at your cleft team, then sometimes they can make a referral to a specialist dentist who's got experience of treating children with cleft palates, because often just your local dentist might be a little bit kind of uneasy about treating a child with a cleft, because they don't see that many. So there are specialist services that some cleft teams can refer you to. So yeah.
Thank you. The next question is, what generally happens to speech with a cleft palate as the child grows? Our child is almost 8 and still has noticeable speech clarity difficulties. Will this improve? And then in brackets, child does also have related hearing loss, which I'm aware may impact.
So as children grow, every child, they don't learn all the sounds all at once, and so the sound system, all the sounds, they kind of follow a developmental path. So our children with cleft palate also follow that path. So they might be unintelligible because they've got kind of typical normal developmental immaturities. And as the child grows, we expect them to grow out of these immaturities. So we will be listening for these kind of typical immaturities and working out what's related to the cleft and what's just kind of typical development. So we will always kind of see your child and monitor speech as your child grows. And what you might find at around aged 8 is that many children have a growth spurt. And so they will do a big period of growing, and with that, the adenoids at the back of the throat, so the lymphoid tissue, like your tonsils, there's kind of adenoids at the back that just kind of shrink away from around aged 8 to 12. And what that can result in is a gap then where there wasn't previously a gap in the palate closure. So your adenoids are kind of shrinking away faster than the palate can kind of keep up with. So some of our children, not every child, but the tone of their voice may kind of take a dip around aged 8, and that may be related to adenoids shrinking away. But again, we will always monitor that, and it may be that some of these kids may need an operation at an older age to help close the gap. And the hearing, we've talked about hearing, and that most children will go through fluctuating hearing, you know, from birth onwards, relating to glue ear, because the tube at the back of the throat, so the eustachian tube that connects to the middle ear, when you're a baby, it's very narrow and it's very horizontal, but as you grow, it gets wider and more vertical, so it drains the fluid and the fresh air into the middle ear. Works better. So children tend to grow out of the hearing, the glue ear and the associated hearing loss at around age 6 onwards, but not every child. So again, really important to keep attending kind of regular hearing checks until you kind of feel like you've got stable, you know, hearing that's within normal limits. So yeah, lots of different factors can come into play as your child grows, but we will always kind of, that's why we keep checking in with you at these regular checkpoints.
And I've certainly had children where we've worked on and they've made sort of steady progress, and then they've just got really stuck on a couple of sounds, and we've agreed that we'll just wait, because it's almost like they haven't understood what we're trying to do, and just the play-based stuff, they're sort of getting a bit old for that now. And I've certainly had children where we've then come back maybe when they're 8, 9 or 10, and they've sort of got it and something's clicked. So, you know, it may well be, again, it depends where they're at and who they're under, but so, you know, sometimes a bit of a therapy gap and then trying a different approach can work.
Thank you. And so the next question said, what resources can you recommend that we can use at home in the early years before we start SLT? We did briefly touch on that, but maybe you could mention those resources again.
So there's many resources, and I direct you towards the Clapper website, because they've got a few videos and links on the Clapper website. So there's a video about input modelling, we've talked about that, and Ellen kindly mentioned that our centre here produced some demonstration videos which show speech therapists kind of modelling sounds and this kind of input modelling approach. So I have shared the link with Antonia, so hopefully you can see that link at some point. And there's babble bags with instructions. So this is another really helpful resource produced by the Welsh cleft team, which is a series of videos which are really helpful, and you can see that link on the Clapper website. BBC Tiny Happy People website is fabulous, and was written by speech therapists in conjunction with psychologists, and has lots of information, activities and tips and advice, and again that link's on the Clapper website. And I'm going to highlight 2 fabulous books which were written by our fabulous Ellen here, and a colleague, I think, was it just two?
It was with Rhiann Hockham and Lisa Farquhar, that from the Welsh team, who are also on the video. Yeah, the 3 of us have written the books together. Two
beautiful books called The Sound We Found and The Sound We Saw, which are available, and that they're, you know, kind of listen and look books designed by our fabulous cleft specialist speech therapists to encourage early sound and rhyme play, and you can get those on Amazon for about £7 at the moment, so those are really fabulous. And
I think all of the cleft centres have got the books, and a lot of libraries have them as well. So certainly in Wales, every library in Wales has them, because Welsh Government commissioned us to also translate them into Welsh, so both copies are available. And actually they're also available in Spanish, because having met somebody from America, they wanted them. So they're the kind of, they were sort of designed to be read from, you know, well, from birth really, with, you know, just getting babies used to that sort of love of reading. And within the book, it's basically input modelling, but as part of the story. So the child, even with older children, they work really well, because the child doesn't realise they're having therapy, basically, you know. So thank you for the plug, Lucy. But yeah, they were. I mean, they are useful with any child, you know, because again, this input modelling, it doesn't just work for children with a cleft. They can be, you know, useful for any child. But they were written with our sort of cleft population particularly, you know, in mind. And again, another thing as well, that I often direct parents to, as well as the Tiny Happy People, is the Speech UK, your website, John, where again you've got sort of like the progress checker, or you've got the different ages and stages and different things like that, where again, you know, parents sort of wanting to know what activities to do with a child, or very much where again, you know, we'll sometimes have referrals in where they'll be referring in, you know, a 2-year-old will be referred in because they can't say, they say no instead of snow, you know, and it's like, that's a completely developmentally normal. Children at 2 don't do clusters yet, you know, that kind of thing. So those sort of advice websites are really helpful as well, so that people know. I don't know if you want to take more about it, John.
Yeah, we've thank you, Ellen. We've got a brand new a new revised progress checker on our website, which is for all ages, really, from birth to 3 months, 6 months to 12 months, and so on, right through adolescence. And previously, it was a questionnaire that parents or school staff could fill out on a child, and you answered yes or no to a series of questions, and at the end, it would indicate if you'd answered no to some important questions. Now we've revised it so there's a yes, no, and not sure option. So we've widened the algorithm. So it's now much more sophisticated. So it will now indicate what areas of support a child may benefit from, and the child in question that the progress has been filled out on behalf of. And there are some short videos as well. Now, these are of a universal or targeted nature, so they wouldn't necessarily be specific to cleft lip and palate, but nonetheless, they're a good starting point to know how to support children's communication. And also there is signposting to other services, and we run an advice line, which I work on 3 days a week, which is a free callback service, so it often directs parents to that as well. I'm happy to share the link to it, actually, so that people can see that in the Facebook Live event. So I'll do that now. Thank you, Ellen.
And one of the things that we haven't touched on when we've sort of talked about it as well, with as you're sort of doing that early input, and it's as much for them to sort of see the sounds and hear the sounds and feel the sounds, is that when we're doing it, parents will often, because the child has perhaps got fluctuating hearing loss, think that they need to make the sound louder, and actually you don't want to do that, because if you're going to sort of do something like puh, puh, rather than particularly with the child, once they've had the repaired cleft, if they shoot the air and they're really sort of forcing the air, then you're more likely that then they might be going and you're going to be sort of shooting the air out of your nose and that kind of thing as well. So it's very much, it's soft, gentle contacts, and you bring the sound in close. So rather than making the sound louder, and I often do it where I'm, you know, saying it to parents and sort of say, hold your hand, you know, out. Can you hear your fingers being rubbed together? And I can just hear them if I hold my arm right out. But actually, if I bring them in here, it's really loud. And I've done nothing to change the sound. All I've done is make a really quiet sound, and I've brought it in close. So, you know, that's one of the things that, you know, we often sort of do. And just to plug you know, just to talk about another book, there's a beautiful book out there called Quiet, by Kate Elizadeh, and it's about environmental sounds and sounds around the house. And I use it as a way of sort of, you know, making it obvious to parents just how much background noise there is, and that actually, if there's all of that going on, your child isn't going to, you know, be able to sort of, you know, hear all the different sounds. But again, there's loads of sounds within the book. So although she didn't write it for that reason, because I've been in touch with her, it's just another book that's got lots of sounds within it, as far as sort of, you know, that whole input sound play that you can be doing just by having a book read.
That's great. Thank you. We've possibly answered the next question, but there might just be something a bit more specific. So the question is, are there any resources you would recommend that we can share with our child's primary school to get them involved in our 5-year-old daughter's speech and language progression?
So every child is unique and different and will present with different speech difficulties, and so I'd really be guided by your speech therapist, who will really tailor their advice and guidance to your child. And it might be that they can liaise with your school or your nursery. But there are a couple of resources that I've really enjoyed, and one is called My Mouth Music Songs, and it's a free kind of set of songs and a workbook to go with the songs, and each song focuses on a different sound used in a really repetitive way. So you can listen to the songs, you can just Google it, and it's online, it's free, and I've shared the link with Antonia, so hopefully we can put that in the chat as well. So that's a really lovely resource. There are some really lovely free resources online that you can access as well. So just to mention a few, one is called Mommy Speech Therapy. So Mommy is MOMMY, speechtherapy.com. So that's some really colourful free speech therapy worksheets that target each sounds in all different word positions at word and sentence and story level. And then there's the Caroline Bowen website. So again, you can just Google Caroline Bowen, free speech therapy resources, and there's loads of word lists and worksheets targeting different sounds. And I think are there anything else?
So, yeah, so the one that I use all the time now is Adventures in Speech Pathology. She's an Australian therapist, and you have to sign up to her website with your email, and then there's lots of free resources that you can use, but also she has ones that you can buy, and they are so reasonable that I'm always letting schools know about them, because there's just pages and pages and pages, because they all download, so you just download it to your computer and you just print off what you want to use. But for example, one of them is they're working on S clusters, and I think it's about 80 pages of every single possible S cluster and whole worksheets, all in beautiful colour. So again, it would take me hours to try and create those kind of resources myself, whereas I can just use them straight away in the speech therapy. I think that whole pack was something like £6.50. So it's the sort of thing where schools, it's easily within their budget to it's not hundreds of pounds for some of these things. And then the other one actually is an app on SmileTrain. There's an app that you can get that again has different sort of games on it, and all of those are free. So yeah, SmileTrain have got quite a few things on their website as well.
I've got another two to chip in, just so I don't feel left out. There's a fantastic free speech and language therapy resource set up in the UK in Tower Hamlets by a chap called Neil, and I can't remember Neil's surname, and I'm very embarrassed because I worked with Neil for many years. But his website is called comtap.org for parents and school staff, anyone at all. Very rich theme of speech and language therapy activities. And there's an American site called speechandlanguagekids.com, which do a very similar, provide a very similar service as well. I've just popped them into the chat, and I'll send them forward for sharing. Thank you.
Perfect. Thank you very much, guys. And so the last question is, pardon my pronunciation, I'm going to give it a go. Can velopharyngeal insufficiency be corrected by therapy, or is surgery the only option?
So we'll just clarify what velopharyngeal insufficiency means. So for those of you who are not quite sure, so velo refers to the velum, which is the soft palate. Pharyngeal is the back of the throat, and insufficiency means it's not closing. So velopharyngeal insufficiency basically means the palate's usually too short, or there's a gap, or there's a big kind of gap at the back of the throat and the palate's not reaching, so it's insufficient. So it's often abbreviated to VPI, so you may have heard of that as well. And as a general rule, VPI, velopharyngeal insufficiency, is related to a structural insufficiency, and surgery is usually the solution there. So there are some types of visual feedback therapy so for example, there's some of you may have heard of a therapy technique called nasometry. So this visual feedback therapy approach has been shown to improve mild nasal speech in some cases. So that's the nasometer is an instrument that has a plate that it rests there with a kind of headset, and when you talk, it measures the sound coming out of your nose versus the sound coming out of your mouth, and it gives you a visual display on a video screen, which is pictorial and attractive for children to look at, and you can encourage children to try and alter the balance of sound coming out of the nose and the mouth by looking at this kind of visual feedback. So that helps in some cases, but it's very specialist kind of therapy technique, and often only usually available at some cleft centres. So it may be worth asking for that, but as a general rule, velopharyngeal insufficiency really usually needs a surgical solution. In cases where surgery is not appropriate or recommended, then we've talked about prosthetic kind of devices that can help close that gap. That may be an option to treat velopharyngeal insufficiency as well. Anything to add to that, Ellen?
No, I don't think so. And but it's always one of those things where it's making sure that there's been an assessment and it is actually VPI. So a lot of what I get in the community is specialist opinions where somebody will say, oh, I've seen this child, they've been referred in, I've seen them in school, they sound nasal, you know, can you see them? And actually they sound nasal because they're doing what Lucy demonstrated before, these active nasal fricatives, maybe on an S and a Z, which in English, because it's our possessives, it's our plurals, it's our is and was and our auxiliary verbs, basically every sentence almost in English has got S's and Z's in, and if they're doing a for an S, like I am sitting on a bus, you're going to say I've got nasal speech, but actually it might not be VPI. So it would always be, you want to just double check, because actually if it's what I just demonstrated there, that isn't surgery, that's therapy, you know. So there's a clear cut sort of, you know, distinction between the two. So we're always sort of making sure that it is actually VPI is you're going to need surgery or, you know, a prosthesis versus a speech, you know, a speech active process, which you can improve with therapy.
And that's a really good point, Ellen, and that's the role of the speech therapist. So don't worry, you don't need to work that out yourself. That's for us to work out.
And of course, it's always that thing where it's never actually always that clear cut, because you can have children with a cleft who are doing both, where you've kind of got where it's that they've got passive air escape, but they're also using the active process of acting those fricatives because they've worked out that that's another way of making a sound. So it's never quite, it's not always that clear cut, but in a lot of cases it is. And a lot of the ones that I see in community, it's not VPI, it's not that there's insufficiency, they've just mislearned how to make those particular sounds.
Perfect, thank you. Just before we close, John, I think you've maybe got a few more resources to mention from your website.
Yes, remember to unmute myself for once. Yeah, if I may just very briefly share my screen, I'll do a shameless bit of plugging. So while we may not specialize in cleft lip and palate, we have a very wide array of services to support children's language and speech. And one of the particular services I'd really like to promote is our free advice line. We've got very, very nice therapists, and there's also me who works on it. We're open 5 days a week, and we'll have a chat with anyone about anything, provided it's predominantly about speech and language. We won't do lottery predictions or anything like that. But if I may just very quickly share my screen and just give you a quick look at our website, I promise I won't take long. If I can find it now. So we've got a resource library for families, which is also for professionals as well, with lots of information sheets. And we've got our help for families where you can come look at signs and symptoms, ages and stages, look at other factors, developmental language disorder and such. But we've also got our advice line link here. So you can come in and you can book in for a chat with a speech and language therapist directly on our online calendar. And you can email us as well. If you'd rather not have a chat with anyone, you can book onto our webinars too. And we've got one last thing, I promise, and then I'll stop. We've got a shop with resources in it as well. So I'll just very quickly show you that. And in here, there are some resources for schools that parents might want to think about encouraging the child's school to buy. Parents shouldn't feel they have to buy the resources for the child's school. We've tried to price them so that they're not overly expensive. They're like 55 quid, the resources for schools, but there's lots of stuff. I could go on about it all day, but I won't. Thank you very much for the opportunity to plug. I'll stop now. And I better stop sharing as well.
You're fine. That's great. Thank you very much, John. That's all we have time for tonight, I'm afraid. For anyone watching, if you would like to provide us with any feedback, we'd be really grateful if you take a few minutes of your time to fill out a little feedback questionnaire, and there'll be a link to that in the chat.
Yeah, and some very important thank yous. Firstly, thank you so much to Ellen, Lucy, and John for giving up your time for talking to us. It is hugely appreciated, and I'm sure everyone watching feels the very same way. Thank you as well to everyone who joined us online. This video will be available on Clapper's Facebook page straight away, and a subtitled version will be posted on the Clapper YouTube channel page as soon as possible. And of course, a big thank you to Jacqui for taking time out of your day to volunteer to host this evening.
Yes, and big thank you to you as well, Anna. Thank you so much. And lastly, we'd just like to say thank you to our funders, the National Lottery Community Fund and Smile Train. It's been a great evening, really interesting. It's been so helpful to myself, and hopefully everybody watching has found it really useful. If we didn't get round to answering any of your questions in the chat, remember that you can get in touch anytime. The email is info@clappa.com, and Clappa staff can point you in the right direction from there. We hope that you've enjoyed the Q&A. There's plenty of other events going on. They can all be found on the Clappa website and the socials if you'd like to get involved in anything else in the future. So that's it from all of us. I hope you all have a lovely evening. Thank you.